I'm going to pull back to sort of a big picture. I'm going to talk more about public health, less about the individual, but more about what are we doing on a bigger scale to work with populations in the area of primary prevention. So what do we do in order to help ensure that healthy individuals are not going down that neoplastic pathway, that we prevent the first incidence of disease, and not only cancer, but other chronic diseases in the general population. So I'm going to use my journey, my career journey, a little bit as a framework to talk about what this looks like, starting with some of the research that I did here, funded by the Hirschberg Foundation on phytochemicals and cancer prevention, and then work towards what I'm doing now in terms of population-based approaches in order to increase access to fruits and vegetables in the general population. So again, as Dr. Go mentioned, I am still listed as a principal investigator in the Center for Excellence in Pancreatic Diseases. And I've been doing research here both in the Center for Human Nutrition and the Center for Excellence in Pancreatic Diseases for some 15 years now. And a key focus of this research has been in the area of phytochemicals and cancer prevention. What is a phytochemical? Some of you may have heard these words before and maybe recognize some of the names of the phytochemicals, but it really, in generalities, is any chemical that's derived from a plant source, whether it's beneficial or not. But usually we use that in the context that it's a plant chemical that really has a beneficial effect on health or on disease prevention. But there is it's not really a nutrient because we don't have any official recognition that these are required for body function. And so again, here's a study that was funded by the Hirschberg Foundation, and I thank you again for the funding for these studies. And this is looking at some specific phytochemicals which are found in common fruits and vegetables. And so we tested this in a cell culture system of proliferating cancer cells, the Miyapaka-2 cell line, and we looked at different dosages of these particular compounds. It's a little bit hard to get over here, but if you can see that in the red triangle line going down, that's a specific compound called luteolin, which is commonly found in things like celery or parsley. And we compared that to, in the pink line, a pharmaceutical compound that was developed specifically to impact a particular pathway that's important in cancer cell proliferation. So the goal of this slide is to demonstrate that even these naturally occurring compounds that are derived from food sources can act with potency, at least in this model system, with a potency that's equivalent to pharmaceutically developed compounds. And again, this particular pathway that is impacted is de novo lipogenesis. So that's the production of fatty acids, which are important for rapidly proliferating cells in order to make their cell membranes. And if you look again at the red line, I'll use the marker here, then you can see that luteolin at 2 doses has a pretty dramatic impact on this de novo lipogenesis, even more so in looking at this from the metabolomics perspective and looking at the flux through this pathway. It has a greater effect than the pharmaceutical compound C75, which is here. So going through these series of studies, some of the things that I learned that are important in thinking about phytochemicals is that phytochemicals from dietary sources confer many disease-preventive properties. So that they are among the important factors that of eating a diet rich in fruits and vegetables that we really don't have well defined yet. And so continuing this research is an important contribution. And earlier you heard about that long time frame, the opportunity for prevention. And we feel then that understanding the dietary factors may increase this time frame for prevention and allowing cells to be protected against that first insult, which may lead them down that neoplastic pathway. However, as a nutritionist, I recognize that a single plant doesn't carry just one of those phytochemicals. They actually have a whole set of phytochemicals, many of which are related, and many of which can act in synergy or in antagonistic fashion, so they can act together in a positive way or act together in a negative way to counterbalance each other. And then many phytochemicals actually have multiple activities so that they can act in various ways and on various different pathways in order to prevent cell proliferation. So from a nutritionist perspective, those kinds of reductionist studies looking at one phytochemical and one particular pathway are actually not very satisfying. Because really what we want to see is a healthful diet in total, that a diet rich in fruits and vegetables will confer a whole bunch of these different kinds of phytochemicals, which ultimately will hopefully have beneficial effects in total. And most importantly, none of these phytochemicals can act in the body if they're not eaten in the first place. So what we know from the population-based surveillance data, and this particular surveillance system is the behavioral risk factor surveillance system administered by the CDC over the whole United States, we know that a low percentage of adults, something less than a quarter of adults, eat 5 a day of fruits and vegetables. And 5 a day, by the way, is not even the recommendation. Now we have the recommendations based on cups. So it's really the amount that we want to know, but we don't have the right surveillance system in order to know how many cups a day people are actually eating on this scale, on a state-based scale. If you read the dietary guidelines for Americans, you'll see that their analysis of those other data sets which do look at how much people are eating, they find that most people only eat, say, 60% of the amount of vegetables they should, or maybe 40% of the amount of fruits that they should. But looking below at these other dietary factors, for example, sugars and solid fats in the diet, refined grains, white bread and the like, people are doing their best to overeat in those particular kinds of dietary factors. So what does this mean overall? And when you factor in relative abundance of inactivity in the population, what we're seeing then is clearly an epidemic of obesity. And I'm sure this is something familiar to you, that you've heard about this before. This shows then the increasing prevalence of overweight adults 18 and older in the US population, and you can see that there's been a dramatic increase, and now in most states, all states, more than 55% of the population is overweight. So why focus on a diet rich in fruits and vegetables? Again, I told you about the phytochemicals, and there's lots of other different kinds of attributes of fruits and vegetables which help reduce risk for not only cancers, but a number of different chronic diseases. And so we know that a diet rich in fruits and vegetables also helps prevent excess weight gain. It also impacts cardiovascular disease and diabetes and musculoskeletal disease. And if you substitute diet rich in fruits and vegetables with basically physical activity and a healthful diet in general, you'll see the same sort of impact. So the lesson is that it's important to address these factors in order to prevent a whole lot of different diseases, not just cancer. So for me personally, I came to the point where I wanted to think about diet and cancer prevention on a grander scale, so on a population scale. So when the opportunity presented itself, I went back to school at Emory and got my master's in public health, and about 5 years ago began the program and began a fellowship at CDC, and was lucky enough to end up exactly in the spot at CDC where they address these issues about how to increase fruit and vegetable intake in the general population. When I say we do it upstream, what that's referring to is, again, thinking about the root causes and ways to prevent disease before there's even the thought of a transformed cell. So this is what we're working, we call this working on prevention upstream. So there's been a number of different attempts in order to change people's behaviors around eating fruits and vegetables. And most of you, I think, are probably familiar with the 5-A-Day program that originated in the California Department of Public Health. And it's evolved over time. There was a 5-A-Day, the Color Day from NCI, and now the current iteration of this branding program is Fruit and Vegetables More Matters, run by the Produce for Better Health Foundation. I want you to take a quick look at this partnership of all these different organizations, including the CDC, and because I'm going to come back to that in another context in a minute. The current consumer messaging from USDA in order to support the dietary guidelines is make half your plate fruits and vegetables. They wanted an easy message. Lots of people didn't understand the pyramid, so this is the latest iteration of how to convince people to eat more fruits and vegetables. However, I'm going to give you a little lesson in public health. It's not so easy to change people's behaviors if you're just focusing on individual level kinds of education and such. So certainly when you're talking about food and beverage intake and physical activity, the knowledge that people have about what's important in the diet, of course, is fundamentally important. And I wouldn't say that nutrition education in schools, for example, is not an important endeavor. But people live and work and play in all different kinds of settings within the community, and in schools and workplaces and recreational facilities. And if there is no access to those healthful foods within those settings, then they cannot actually make those choices for both the healthful foods and to engage in physical activity. And even broader than that, there's a number of different government policies, production, food systems, all that interplay on the availability of the right kinds of foods, and overlay all of that with cultural influences and religion and such to make this picture a lot more complicated than might seem at first glance. So the director of the agency, Tom Frieden, has summarized where public health resources might go in this context to say that let's focus in down here towards the base of the pyramid to changing the context to make individuals' default decisions healthy. And so in short, that's make the healthy choice the easy choice. And so you can see that rather than counseling and education that might help more at the clinical level, and certainly those things are important, but it's a one-to-one kind of approach, and in terms of public health resources, that's very labor intensive. So we're looking a lot more at these kinds of approaches which change the environment. So we call them policy systems and environmental approaches in order to make the context easier for people to make the healthier choices. Ultimately, the socioeconomic factors have a great deal to do with whether people are healthy or not. Poverty, of course, is a great predictor of poor health. However, that's a big cultural and societal issue that's more than most public health practitioners can really address. However, from our perspective in public health, we often look at the disparity lens as we're looking at programs in order to make PSE level changes. So again, to paraphrase, where can change happen? It can happen everywhere that people work, eat, play, recreate, learn, worship, meet, and live. And what is the goal? Making the healthy choice the easy choice. So from the perspective of our division, the Division of Nutrition, Physical Activity, and Obesity, what we are encouraging with our public health partners is change in policies, systems, and environments to meet these different goals. One is to increase physical activity, to increase breastfeeding initiation, duration, and exclusivity, to decrease consumption of sugar drinks, so sugar-sweetened beverages like sodas and the like, decrease consumption of high energy density foods, and increase consumption of fruits and vegetables. So I work with a team that particularly focused on that last point, to increase consumption of fruits and vegetables. I like that personally because I can tell people to eat more of something and not eat less of something. So we've summarized in this document the strategies that we promote for increasing fruit and vegetable consumption. And so members of my team are working in virtually all of these areas in order to provide technical assistance, to provide guidance to our public health partners around these different topic areas. And in the interest of time, I'm not going to talk about each one of these, but I'm happy to answer questions about them later. And I'm going to talk specifically about some of the work that we've been engaged in schools and childcare and around institutional food service guidelines. So this is my personal passion, and that's farm to school and farm to preschool programs. And the objectives of these kinds of programs are in order to serve healthier meals in school cafeterias and in childcare, improve student nutrition, and to link agriculture, nutrition, and education opportunities in the school environment in multiple points throughout the day. It also has the added benefit in order to support the local economy and regional farmers. And in this emphasis on local food really comes a big nutritional education component, that people get more inspired when there's a face to their food. When they've seen the farmer that grows their food, they really start to link the importance of food coming from the ground and not coming from Kroger's wrapped in plastic. So we really feel that this is an important component as well as of the idea of farm to school programs. Throughout the country, there's some 12,000 programs, and they're impacting probably 6 million or so kids already, but we don't have a good handle on that. USDA is working on that. We have some evaluation data that there is a positive impact on student knowledge, attitudes, and behavior towards healthy food. Fruit and vegetable consumption increases when kids participate in farm-to-school programs, and and healthier choices are provided for them. Teachers' knowledge and attitudes change towards food and providing healthier foods, and local farm income is increased as there's a new market that's provided for small to medium scale farmers. This document, Bearing Fruit, summarizes some of these evaluation research. So that is coming out of the National Farm to School Network, and I work closely with the National Farm to School Network nationally and in many states in order to promote the farm to school programs. So what are the kinds of activities that happen in farm to school? There are things like gardens, local purchasing of food, cooking classes, farmer visits to classroom, field trips to farms, taste tests, composting, and the like. And I'm ending up here with cafeteria salad bars because those are often a very important tool of introducing locally grown food to kids. But we're also working on a bigger picture program that's called Let's Move Salad Bars to Schools. So this is one of the Let's Move sub-initiatives. It is in conjunction with the White House and the First Lady's office. As you can see here, Secretary Sebelius, our big boss in Health and Human Services, is here inspecting a salad bar in Long Beach, and we're supported also by our agency, the Health and Human Services. This is a project of this coalition, and I mentioned to you that list of partners under the 5-a-day program. They are part of the National Fruit and Vegetable Alliance. So CDC helps organize this National Fruit and Vegetable Alliance in partnership with the produce industry in order to work on different kinds of approaches in order to promote fruit and vegetable consumption in the population. Our other partners include the Food Family Farming Foundation, which is an advocacy group out of Colorado, initiated by Ann Cooper, who some of you may have heard of in the context of school lunches. The United Fresh, so that's the United Fresh Produce Association, their foundation is also a key partner. Whole Foods Markets and their charitable arm, the Whole Kids Foundation, are also a key partner in this program. So we have a $15 million goal to raise money in order to purchase salad bars and put them in schools. And again, this is in conjunction with the White House, but all of us in government are not allowed to do this fundraising part, so our partners, of course, are the key to actually raising this money. The goal is to donate 6,000 salad bars over 3 years. To date, we've donated 1,600 salad bars in most all of the states and the District of Columbia. And the impact then is that 800,000 kids have salad bars in their schools that didn't have those previously. The launch took place in November of 2010 in Miami, and I had to interrupt a Thanksgiving trip to New Orleans in order to participate in this launch event, but it was a lot of fun and it was worth the disruption. And why salad bars? Why would we focus on this one particular piece of equipment for schools? It's because that we do have some good data, especially coming from LAUSD and Wendy Slessor's work, to show that putting a salad bar in a school does increase the frequency of fruits and vegetables consumed during the day and does affect diet quality of those kids that use the salad bar. What we're finding is that idea of choice really affects kids, and that they do choose more fruits and vegetables when they do have a broad choice. And in fact, this year, the school meal standards have changed. The USDA National School Lunch Program standards have changed in order to require schools to offer a greater amount and a greater variety of fruits and vegetables in schools. So this is one tool that schools can adopt in order to implement those new standards. Riverside Unified School District has a very well-known program in which they've now served several million salad bar meals. Rodney Taylor is the leader of that program, which began in the Santa Monica Malibu School District when he was there and now is at Riverside. And we have data also from the National Youth and Physical Activity Nutrition Study, an analysis that I did, that high school students who usually get a salad bar are more likely to eat more than 2 fruit and more than 3 vegetable servings per day. So if you're interested in finding out more about this project, this is our website, saladbars2schools.org, and happy to answer any questions. And if you're interested in engaging, I'd love to speak to you. So let me go on to the second strategy area that I mentioned, and this is around health and sustainability guidelines for institutional food service. So what does that mean? So these are standards that could be used for purchasing, preparing, serving, and selling foods and beverages in the institutional settings. So the goals of this are not only to improve dietary quality, so the offerings that are available in school cafeterias, for example, hospital cafeterias and the like, but also there's a sustainability component to look at the ecological benefits of these guidelines. And what we really consider this is an implementation of the Dietary Guidelines of America on a population scale. So where could these apply? They could apply anywhere where food is sold, served, or consumed. So we're focusing initially on ourselves, on the federal government, and what can we do to change what's offered at the federal government work sites. And this is translating to states and to local venues, which I'll talk about in a minute. But it also could apply to a whole number of institutions, both public and private, which are listed there under the settings. So within these institutions, we're talking about the cafeterias, the snack bars, the vending, the lunchrooms, and what's offered in meetings and conferences. So coming out of our group are these health and sustainability guidelines for federal concessions and vending operations. So these were written by members of our group and are now adopted by Health and Human Services and the General Services Administration in order to address those 2 agencies' purchasing. So again, they increase the healthy food and beverage choices and the sustainable practice at these federal work sites. And these were released in March of 2011. So already we see a huge reach of these guidelines. So these apply to all food service concession operations and vending machines managed by Health and Human Services. And so that impacts about 120,000 employees in that work site. And it also impacts something like 10,000 buildings that the General Services Administration operates. The General Service Administration in the Capital Region, we know, has about 20 million annual transactions in their cafeteria, vending, and the like. So if you look at this reach, that is a huge, huge impact. Even if it's 1 snack, 1 meal a day for an employee, over the number of employees and the number of transactions, it could have real significance. Again, this is being implemented as contracts are renewed. Currently, 20 out of 107 GSA commercial cafeteria contracts now implement these guidelines, and there's voluntary implementation in 25 other GSA commercial cafeterias. We expect other agencies to come on board with these guidelines. And now that it's incorporated into the National Prevention Strategy, which came out of the Surgeon General's office, there's 17 other agencies which are part of the National Prevention Council who have signed on in order to implement these in their different agencies, including the Department of Defense. So if you start thinking about the military and whether we can change what's being offered to soldiers in the military, in their camps, in their bases, this could have huge, huge reach as those people, young, healthy individuals, are eating all their meals through the Department of Defense. We've also been working with the National Park Service and their Healthy Parks, Healthy People initiative. They've already adopted a healthy food strategy to provide healthier food options for all their 280 million visitors that come to their national parks annually. And again, I mentioned that states are now looking at what's being done in the federal government in order to adopt similar guidelines at the state level. We have 12 states that we're working with currently, and a number of different communities who are being funded through CDC, through the Communities Putting Prevention to Work or Community Transformation Grant programs, in order to make changes in their communities. And I'm actually going to tell you a little bit about Los Angeles County, who is funded through both of these programs, previously through CPBW and now through CTG, to work on changing the food options that are available in their facilities. So the three strategy areas that they're focused on is to support selected cities in LA County to implement strategies to increase access to healthy food and beverages, to establish food procurement policies in LA County government departments. So they're actually working with contractors as, again, contracts are renewed in order to ask them to provide healthier options through their cafeterias and through vending, and working with Los Angeles Unified School Districts to increase fresh preparation of school meals. So just again, looking at the reach. So if you're talking about the people that eat out of these facilities every day, through the worksite cafeterias, the mobile trucks, the snack shops, that's thousands of people. If you start looking at residence facilities like the jails and the probation camps, that's tens of thousands of people. And those are people that are eating multiple meals a day and hopefully getting more healthful meals as these guidelines are implemented. Within LAUSD alone, they're serving 650,000 meals a day. So it's a huge number of kids that are also impacted. So to summarize what I said is that we're very interested in these policy systems and environmental approaches. And you can see, I think, from what I've demonstrated is that the reach can potentially be huge. And I didn't explicitly go through this, but our perspective is that looking at the entire food system from the point of production through distribution through what's available at the consumer level are important considerations. And we actually work quite a bit with USDA to talk through all of those different aspects. The strongest programs, what we have found, apply multiple interventions in multiple settings. Some of you may have heard that now we're starting to see some tipping over of the increase of rates of childhood obesity in certain communities in certain states. So that we're starting to maybe seeing a plateau of childhood obesity rates in certain areas. And what we found looking at what's happening in those different locations, it's especially those where there are strong anti-obesity initiatives which are addressing multiple settings and in multiple different ways. Kids, child care, schools, worksite initiatives, all of those together are going to make the difference. And so what I tried to begin all of this with is to say that cancer prevention in the primary sense also will prevent a number of other different chronic diseases. And so we think that it's important to really focus on this primary prevention, not only for cancer, but for heart disease and all the other major killers of adults in the United States. And I hope that you've gotten the message throughout the day talking about this latency period before cancer really develops, is that promoting a healthy diet and lifestyle habits need to start as early in life as possible. I'm personally committed to trying to change nutrition guidelines around what's offered in childcare and Head Start, in all of those kinds of early care and education settings where we can maybe have some impact through to the schools, and then through the lifespan and all the settings that people are engaged in throughout their lifespan. So again, prevention happens upstream. I hope that I've been able to convince you of that. And thank you for letting me come and tell you a little bit about what I'm doing now.